Dr. J.N. Ibekwe, CMD, CEO, Northland Medical Center, Abuja, Nigeria. It's a pleasure having you on the WASU platform on our campaign tour, and of course honoring you for your contributions to nation building. What is your take on the effects and issues such as drug abuse and social vices by youths in West Africa?
Let me look at drug abuse in two contexts. Well, the illicit drugs and other drugs are conventionally prescribed but are not used as per the doctor's prescription. Illicit drugs include commonly in Africa cannabis, use of cocaine, heroin, amphetamines, and others. These are drugs that has no place in medical prescription, but are being abused by the youths. And then the other ones are the prescription drugs that, for instance, are prescribed paracetamol for 3 days, and somebody decides to take all of them at once, or take one out of 500 milligrams, for instance, out of the 1 gram I wanted to take for a day, for in a dose, and all that. So the effect of drug abuse is multidimensional. I recall when I was a child in my village, the commonest drug of abuse then was we had very many promising youths, about 4 of them who decided to indulge in the intake of Indian hemp. Gradually, over the years, we noticed what I call the personification. The individual becomes not really but a soul that dwells on drugs. Essentially, 2 of them have died, but the other remaining ones are simply wandering lunatics in the streets of my town. Drug abuse, use of illicit drugs is the surest way to destroy a community. Because once you have destroyed the child, when you have destroyed the mind of a child, that child, the community is gone. Because the future rests on that child. And once that future cannot be upheld, that individual, that community, that society is finished. That is one effect. Other effects include increase in social vices, its psychological effects, emotional effects, and biochemical effect it has on individuals. Certain drugs, once you have started and getting hooked to it, when you do not take it, it manifests so many, it has many manifest effects on the individual. For instance, the withdrawal effects of the drugs. Somebody on cocaine or heroin who cannot get access to that will do anything possible. If he doesn't have money, he steals. That's the social vice component of that. Once he steals, he gets the drug, he's high for a few minutes, and within the period he's high, he doesn't have any control of himself. Similarly, alcohol has similar effects on both the individual and the society, including women who are, increasingly becoming involved in that. Alcohol has effect on a pregnant woman because it destroys, or it has some harmful effects on the developing fetus. You see some children who are from parents with good genetic makeup that relatively if this child grows is born without any intoxications, the child will certainly have the potential to grow well. But you see, the child will be born with features of what we call fetal alcohol syndrome, multiplicity of complexes, ranging from mental disorder, low intelligence quotients, abnormalities in development, and of significance is when they grow up, they may come up with some abnormalities in behavior, what we call antisocial behaviors. You understand? So, the effect of drug abuse is multidimensional. I must be discouraged in a year. Okay. Go to hospital when you are sick. Get doctor's prescription. Stick to the prescription. Do not go into alcohol abuse. Do not go into substances of abuse, illicit drugs, and do not manufacture things you think may, influence your health. Some people go to the toilet, they inhale the the odor that are coming from that, because that odor contains some substances. They get high on certain things, get high on glue, get high on certain inhalational substances. So essentially, it damages the individual, it damages the community, it damages the society, and at a wide range, it damages the country. So it is a significant problem in a country, especially in Nigeria, where the youths are most vulnerable. The youths are less empowered, so they have all the time to get involved in things that cannot be considered socially acceptable, of which drug use is one.
Okay. Also, Doctor, what is your take on female genital mutilation and some other harmful cultural practices?
Yeah, female genital mutilation can be defined as partial or total let me put it, infringement or injury to the genitalia of a female. The classification is from class 1 to 4, ranging from removal of the clitoris, from the removal of the labia minora to the majora, and sometimes the traditional birth attendants excise the whole thing and stitch it and what we call infubulation. That is the highest grade of that. And then it is common, a very common trend in Nigeria, especially in the southern region. The south, where the prevalence is higher, it is the highest, followed by the southeast and the southwest. And other regions of the country, apart from the Fulanis, is the only region in Nigeria where they do not practice such harm on the female. It is a very harmful thing. It is a very antisocial thing. It is a cultural thing that should be banned. Banned in the sense that it's a humiliating thing on a child. It abuses their rights, and for those who have grown up, it is equally an infringement of their rights, causes a lot of complications that are not acceptable, such includes infections. The traditional birth attendant or traditional healer who does that does not have any knowledge about the concept of disease transmission. So the knife, the sharp object he uses to cut into the genitalia of the female one may be used similarly in another. So infections like HIV infections and other infections may be transmitted. Two is that it affects the ability of the woman to socially enjoy sex. Primarily, these are the sensitive areas of the woman's genitalia that can be, that gives the orgasm when a woman is in a natural state and could, as a woman, right, be able to enjoy sex. So when these things are distorted, one, there is pain after the procedure, during the procedure, after the procedure, and much later. Acute and chronic pain, scarifications, the scar tissue forms. It doesn't allow the genitalia of the woman to, expand as it should during childbirth or during introitus, during sexual contact. So it kind of narrows the introitus, makes it non-expandable, and could lead to complications that you notice when the woman is having a baby. You understand? Instead of, for instance, a woman is to deliver a baby that could normally pass through there, because the genitalia cannot, relax and all that during the effort to push. You see that we have every need for other interventional procedures like episiotomy and all that when it shouldn't have been, and it could lead to excessive tear when that the muscles can no longer relax because of the presence of scar tissues. Okay. So it must be discouraged by enlightenment, by education. Going into the grassroots, telling them about the dangers that are inherent in this, and discouraging people, not by force, but by simple education. Once they're educated, sure, the effects can be appreciably evaluated, and this kind of cultural habit put to a stop. Right. How do we put that to a stop? By getting the government legalizing it, making it illegal for such procedures to be carried out on our females. Again, making sure that what we call medicalization. Some Orthodox fellows are getting involved in that. So I make it illegal that any registered medical practitioner, that is those nurses, midwife, community health, is involved in this, will be punished, prosecuted, and sentenced. That way, we have established a policy or a polity that discourages a culture that we have known, and that is very harmful to women.
Okay. Finally, your advice for students and youths.
The most significant advice I'll give to the youth to be educated.